once the patient enters our department, we'll start with an assessment. We have an orthopedic assessment or a neuro assessment, depending on the case. Once we are done with that, then we'll go for posture analysis.
I can explain some exercises that you can do. IT professionals can do some on sittings posture. Okay. First of all, our posture is one of the main thing that we should maintain while working on computer or laptops. So first of all, we should adjust our screen size to our eye level or shoulder level.
I don't think you require a physio to assess your posture. Just go in front of a mirror and just see yourself.
Yeah.
So you can see the asymmetrical level on either sides. Seeing a healthy individual who is used to work out on an everyday basis, and if you are explaining to them about his or her body posture, then I don't think they will be liking it.
We have a system called manual muscle testing, MMT. So we have a grading system from 0 to 5. 5 is the maximum power, with full range of motion with maximum power, maximum resistance. 0 is like there is no power.
Wohlphysio, as the name indicates, it's about wellness. So we are mainly focusing on the wellness of the patient.
Player hit a ball on his chest and he fell down. And he was going for the fixed condition like Caesar. He was shivering and his eyes were gone down and he was pumping the blood from his mouth. It's not my initial stage actually.
Hello all, welcome back to my podcast. Today we have 3 special guests from the field of physiotherapy. We have Suneel Sir, who have 22 years of experience in the field of physiotherapy, who have completed his BSc in physiotherapy and then completed his master's in psychology. On the right hand side, we have Rosmin, who have 3 years of experience in the field of physiotherapy and working as a physiotherapist at Wohlphysio'S. She also completed her bachelor's in physiotherapy. On the left hand side, we have Hyshem, who have 1 year of experience in the field of physiotherapy, working with Wohlphysio'S and specialized in sports physiotherapy. And he too completed his bachelor's in physiotherapy. So let's start our podcast. We would go first with Suneel Sir and listen about his experience, the 22 years of experience in the field of physiotherapy. So over to you, Suneel Sir.
Hello, good afternoon. First of all, thank you for giving us an opportunity to talk in your podcast. On behalf of Wohlphysio', myself Suneel, Hyshem and Rosmin, we are glad to be a part of your team. Regarding my experience, started with clinics and I was working in a hospital back in Kerala. Then I moved to Middle East. I was working with NMC hospital for 14 years. That was in Muscat. There I was working in a hospital, mainly concentrating orthopedic cases, like post-operative cases, then medical and surgical cases, mainly post-surgical cases. Medical cases, I was handling stroke and neuro rehab cases. Right. There was few pediatric cases like cerebral palsy and muscular dystrophy cases. And after that, I moved to Maldives. There I was working only for 2 months. I was working with IGMH hospital. I was handling inpatient and orthopedic cases. Then back in Kerala, I was working with Mana Health. That was for 1.5 years. Then again with Sarah Garden Hospital, that's a neuro rehab hospital. That was again for 1.5 years. Right now, from the past 3 months, I'm working with Wohlphysio'.
Thank you, Suneel Sir, for that brief introduction. Before coming to Rosmin and Hyshem, I want to ask one thing to Suneel Sir. As per my calculation, you might have completed your education in 1997, your bachelor's, then you started with physiotherapy. So I just wanted to know from your side how that idea came up in your mind that you have to do physiotherapy or you wanted to choose this career path as physiotherapy long back in that year of 1997.
That's an interesting question. My mother was a nurse. She was working in Middle East. So when I used to visit her during her working hours in the hospital, she used to take me around in the hospital. So once I visited physiotherapy department, there the physiotherapist took me around and explained the whole techniques and whole scenario on what's happening in the physiotherapy department. And he used to tell me that you should be a physiotherapist in future. Your ambition should be a physiotherapist. He insisted me. So somehow that time I was working. That my age was like around 13 or 14 years. I didn't know what is physiotherapy, or I didn't have any idea about it. But he forced me. Then from there onwards, I was thinking about I should be a physiotherapist because someone told me, right? Then once I done my 10th and plus two, then I focused towards physio because I came to know more about physiotherapy. What they were doing, and it's saying like we are working like a doctor, or we are saying like considered as a medical profession, not a paramedic. So I was more interested in treating patients, seeing a smile in their face, rehabilitating them, and bringing back to the normal life. So I was more interested in such a way.
My next question is to Rosmin. I know you have 3 years of experience in the field of physiotherapy. As I asked Suneel Sir, similar question to you. What motivated you to be a physiotherapist?
To begin with, I started my career as a physio at Wohlphysio. So, and during childhood, I was always fascinated. I was always fascinated by the healing of the body. So it's like, so I always wanted to do something in a medical profession. So either a doctor or something related to it. So once after my 12th standard, I thought about why not trying physiotherapy, because it's more about, it's more attached to the, it's like, to be honest, it's always about the physical. See, in nowadays, all the doctors, what they're trying to do is they are prescribing medicines or surgery or anything like that. But physiotherapy is more about the mobility and function. They are trying to improve the quality of life of the human being. So I always wanted to do something related to it. So that's why I have chosen physiotherapy. So I did my BPT, bachelor's at AJ Shetty Medical College, Mangalore. Then soon after that, I did another course in acupuncture as well. And after that, I joined Wohlphysio because this is more about a musculoskeletal and sports clinic. That's why I've chosen Wohlphysio. So here, this is my third year. So it's been a long journey. I've seen multiple cases and multiple recoveries that brought back results in one's life.
Thank you, Rosmin, for that brief introduction. Let's move to Hyshem. I know Hyshem personally. I have met him during one of the tournament. He was our sports physio, and he had done a wonderful work during that sports event. So Hyshem, similar question to you. You have almost 1 year of experience in the field of physiotherapy, and I know you have started just 1 year back. So how you came into the field of physiotherapy, and how was that upbringing from your side into the field of physiotherapy?
Actually, I'm fresher to this field. I have started my career just only 1 year before. I'm working as a sports physio. As you know, I have attended many tournaments like football, cricket, everything. I am facing injuries, to doing first aid injuries I'm facing. As you know, someone will get ACL injury and ankle sprain, and we need to heal at the time only. And the player need to again restart the match. So it was a new beginning for me, and I think I'm doing well at that field. Actually, I have studied my degree at Mangalore. It's in my college name is Suneel Medical College. I have completed my degree in previous year.
Thank you, Hyshem, for that brief introduction. I would like to ask one thing to Suneel Sir. As I know, you have completed your education long back, 22 years, and you do have experience of physiotherapy almost 22 years. So I just wanted to know from your side, how you stay updated with the latest advancements in physiotherapy, and what was that role, like how you build your continuous learning to play a success in the field of physiotherapy?
Back in 1997, my course duration was from 1997 to 2001. So that time, we didn't have any courses like taping, myofascial release, or cupping, or any other techniques. So later on, like around in 2000, I started doing add-on courses because that was more effective than using the modalities. Initially, we were more concentrating on modalities like machines like IFT, TENS, and traction. Then once the scenario has changed, there was more evidence-based research on hands-on techniques like myofascial release and other exercises, advanced exercises. So I was forced to learn all these techniques. Now I've done my course on like, trigger point release, then cupping, taping, myofascial release. Now I'm practicing that as well. On top of that, I've noticed that patients were depressed during the treatment because they'll be having some other issues apart from the physical issues. So we have a subject called psychology in our physiotherapy during our physiotherapy course. But to know more about that, I've done a master's in psychology, so that it's easy because most of the diseases are psychosomatic. So we need to talk to the patient. We need to find out what is the reason behind it. So I just want to learn more about it. So I've joined for that psychology course. So it's easy for me to communicate and give a solution for that.
Now you talked about this cupping, taping, needling, acupuncture, all that treatment that has done in the modern technology of physiotherapy. So I wanted to know from your side how you educate it to the patient and how you let them know what are the benefits of it. Or a patient comes up and tells that I have a pain in this joint and you are suggesting him the cupping, he have never known about it, how you tackle that situation. So I wanted to know that from your side. Anyone can from you take this up and give an answer for it.
Once the patient enters our department, we start with an assessment. We have an orthopedic assessment or a neuro assessment, depending on the case. Once we are done with that, then we'll go for posture analysis. Then we'll check his vitals and all the other blood works and all. Once it is done, then we'll decide which treatment to be done. We can't give dry needling for all the cases, or we can't give traction for all the cases. So we decide accordingly, depending on the case, depending on the age, their muscle power, so and so things. So once it's done, then we'll explain these are the treatment to be done. So we'll explain about the merits and demerits, what are things to be taken care of, precautions to be done, do's and don'ts and all. Once they're convinced, then definitely we'll start with the treatment. Treatment duration depends on the improvement. We can't insist on so and so days. So we have to tell them like it depends on the signs and symptoms. Once the signs and symptoms are reduced, then we can gradually reduce. But still, you have to come for exercises. Exercise is a part of our treatment, and it should be lifelong. It's not like for a few days. It should be lifelong. You have to maintain your muscle power, and you have to maintain your flexibility. So stretching and strengthening should be a part of your life. So it should be a routine. Okay. And regarding the treatment modalities, I think Rosmin will be better. So she'll explain regarding the different techniques that we are using.
So as Suneel Sir said, so once a person enters the clinic, all he wants is to get rid of the pain. So it's like the patient doesn't know. I mean, the root cause for the pain would be his posture. So probably, so for example, if he's working in an IT field, he'll be sitting for for a long time. So that's why he can strain his back or neck or other parts. So it's like once he enters the clinic, he'll be like complaining. Just imagine if he's complaining of back pain, and he'll be like, it's just a common condition for him, but he might have taken the painkillers or some muscle relaxants or something, but which could have subsided the pain. But after a while, again the pain starts, so he will complain of the pain again. So that's why first what we do is that we'll assess the patient about the posture. Like if you're sitting continuously, it can strain your back, right? So which will educate them. And after that, we'll be doing some modalities, which is like ultrasound or electrical stimulation. Ultrasound, it's an ultrasound therapy, which is for reducing the inflammation or muscle spasm on that particular area where he or she complains of the pain. So it's like the sound waves are being passed onto it, which helps in penetrate into the deep tissues for healing. So another one is called muscle stimulation. It's like with the pain he won't be able to do any sort of exercises. So what we suggest is that for the strengthening part, we'll be depending on a modality where it's also a kind of strengthening. We are just contracting the muscles with the electrodes, and which is also giving a sort of pumping effect to that muscle area. So these are the modalities we mostly use and in our clinic. And once we don't see the progress, we'll be focusing more on the myofascial release. It's like we are releasing with our hands or knuckles. It's like there will be muscle knots at that particular area, which results in the stiffness. To reduce that, we'll be doing the myofascial release, and if still he or she complains of the pain, we'll be doing the needling. Needling, it's like we are releasing that tightness onto the deep tissues, so which will also result in painless, so pain free. Okay, so these are the main things which we follow in our clinic. So all we focus is that once the pain is gone, we'll be focusing more on the strengthening and stretching part. See, nowadays many people are following the sedentary lifestyle. Because of this, they are they elicit this kind of stiffness, pain, and everything. So once the pain starts, they will neglect the pain and they will proceed with their life, because everyone is busy with their life, so they won't give time for silly pain or anything. So they won't address it unless it gets severe. They will go to a clinic or go to a doctor or anything. So what I suggest is that always everyone has to be aware of their posture, and everyone has to do the exercises on a daily basis. Not at least workout, but at least stretching on an everyday basis.
Now, regarding the exercises, I should will explain what all exercises we are doing, like stretching and strengthening.
I can explain some exercises that you can do. IT professionals can do some on sittings and posture. Okay. First of all, our posture is one of the main thing that we should maintain while working on computer or laptops. So first of all, we should adjust our screen size to our eye level or shoulder level, and our seat position should be have C-shaped curve. Okay, and we should be maintain that. If it's not maintained, we should place a pillow or on our back side to support our lumbar. Okay, and our hand should be placed fully on the table. And I can explain some exercises that we can go for stretching our forearms on both sides like this, and we can also traction our wrist for reducing the tingling sensation that while occurring or using laptops or computer for IT professionals in a long period of time. So these things we can do or while on sittings.
I think I also need to change my posture.
Yeah,
I also
yes.
work a lot and
Yes.
currently.
Because nowadays most of them are in IT field, so it's the problems is occurring due to our posture and habituals. So we should change our habits and posture to correct our problems.
And I don't think you require a physio to assess your posture. Just go in front of a mirror and just see yourself.
Yeah.
So you can see the asymmetrical level on either sides. So if you're sitting for prolonged time or you're continuously standing for prolonged time, so if you're straining your muscles, definitely you can see the difference.
For a long time, your muscles will go for stiffness. Especially when you're sitting like this, the front part muscle, your pecs go for tightness, and it will end up as a rounded shoulder, and back muscles will go for weakness. And again, there are chances of muscle shortening because you are not using this muscle at all. These movements are not happening. So where they'll be having trigger points and all. So that we're getting many patients from IT professions for having trigger point and muscle tightness. So there are certain exercises that to be done during their working hours to maintain the flexibility.
Most of them are getting a vitamin D deficiency because of lack of exposure to the sunlight. So most of all of the IT professionals, in my opinion, they should check up in at least for 6 months their vitamin D levels. Most of them will be insufficient. So try to maintain them.
And also, most importantly, the watering rate.
Yeah.
Every day you have to drink at least 3 to 4 liters because it's mandatory. Because if you don't have that enough fluid in your body, there are chances of stiffness again.
Sickness can lead to disc bulge and many other problems. So the basic root cause is stiffness.
Because we are sitting in an air-conditioned room, you won't feel like drinking water because there is no sweating, right?
Yes,
So-
and also frequent urination,
Urination, yeah.
probably.
So you have to drink water. So if you keep a water bottle in front of you, you'll feel like drinking water.
Do you have water bottle with you?
Water is there, right? Water is there, right?
Yeah, water in there, water in there. Now you were mentioning all this, how to do a posture check. A patient should check themselves standing in front of the mirror and knowing that if the posture is correct and all that. Do you feel there is something that a patient or any person should do, like a regular checkup with a physiotherapist in every 6 months or and in a year to check is there any kind of postural change in their body? Do they have any kind of pain which could lead a major or a severe issues in the upcoming days? So do we need to do any kind of checks? Because as I know, people are only coming to physiotherapy if something has been recommended or if they have any kind of injury. If a doctor recommend them you need to go to a physiotherapy, then only they go to a physiotherapy. If they feel a pain in their neck, then only they go to a physiotherapy. Point on that.
If you don't have pain, you can just visit a physiotherapist and you can get done your posture analysis. Because what happens is when you sit for a long time or if you're standing for a long time, there are chances of muscle tightness, even joint pain. So what you can do is always get it done and check. We have an app to check your posture, so we can see the deviation and we can recommend the exercises accordingly. We can give the stretching and the strengthening. So you can get it done, the posture, and that's the main thing. Another one is like a strength. Suppose your back muscles are weak, you need to strengthen the back muscles because they don't know what all exercises to be done. So those exercises, we can ask a physiotherapist not to check in the internet because there are many exercises that not to be done. Always consult a physiotherapist and check with them like which is the safest exercises that to be done, and they have to do it and progress as well because you should not do the same exercise throughout a year. You have to keep on changing. That's why you have to go for follow-up sessions.
One more question related to the topic which you discussed right now. When you mentioned the posture and all that, a person standing in front of you and you feel that person's posture is not correct, he might face a pain in the upcoming days, but right now he don't have any kind of pain. But you know his posture is not correct. So do you go ahead, talk to that person and let them know that you are facing an posture issue or you need to do this kind of exercise and that kind of exercise? I know it's difficult to approach people directly, but what is your point on that?
Basically, we focus on ergonomics. We can't stop them working. We can't stop their activities because that is their day-to-day activity, right? So they will be the breadwinner of the family. So we can't stop their activity. So what you have to do is we have to explain the ergonomics. For example, suppose your person is sitting in front of a computer. So where should the computer should be the place regarding the hand placement, regarding the shoulder placement, back support, ankle support, knee joint placement. So all the joints we have to cover. And we can explain the exercises that they can do in between their working hours. So that will help to prevent injury and they can do the work in a normal way. And we can't stop any activity. Suppose a runner or suppose an athlete who is planning to for an event we can't stop them. So what you can do is teach them exercises, teach them do's and don'ts, what to be done, what not to be done, and do the exercise, monitor the exercises, and progress accordingly.
And also, if we are seeing a healthy individual who is who used to work out on an everyday basis, and if you are explaining to them about his or her body posture, then I don't think they will be liking it. So he'll be like, I used to work out on a daily basis and I don't have any pain. So why should I bother about my posture? And that question arises like that. So it's always like we need to educate the patient, and not just the patient, educate everyone about the posture. So it's like if you're straining your muscles for a long time, be anything. You see, every work requires its own, straining. So if you're continuously straining it, then you need to give the nourishment like stretching exercises. And if you're excluding it and continuing your work, it can lead to severe conditions.
Next question to Rosmin. I know, Rosmin, you have almost 3 years of experience in the field of physiotherapy. So I wanted to know from your side, what is the professional development and growth in the field of physiotherapy, and what you have faced in your entire career of physiotherapy?
Once I started my career, see, to be honest, everyone among my family, except my parents, they think like physio is all about a masseur. It's similar to a masseur. So they're like completely teasing me over this, like by calling me the name as a masseur. So I explained to them already. I will explain to them like it's not about masseur. It's about the mobility and joint function to reduce the pain and all of that. But still, many of them, and I think many of them will, still consider as masseurs. So as day progresses, the quality of physiotherapists also it's improving day by day, because I think the demand for physiotherapy is improving. I think 4 or 5 years back, the doctors will suggest physiotherapy, or the doctors will themselves will do the physiotherapy. But nowadays there are separate clinics and separate physiotherapists who are performing this, and day by day it's improving. So being as a physiotherapist myself, I feel so passionate about this, and I'm seeing the progress of developing physiotherapy. It gives me immense pleasure. So as working as a physiotherapist, so it's more like now everybody is more bothered about their posture, their pain and everything. But previously, or 4 to 5 years back, they were completely depending on the medicines. Now they are like, the mentality has changed to like they need to correct the posture, to correct the pain, and they straight away go to a physiotherapist before consulting even a doctor. So I think that's quite a progress in our profession. So yeah. In fact,
In sports also, we are getting more higher.
yeah,
Physiotherapists.
exactly.
Even if you need to conduct a match, there should be a physio. It's the rule.
And also, previously, in physiotherapy clinics, mostly, they take only males. But here, even in our clinic, there are more females. So I think that's quite a progress.
Even regarding the exercises, the doctors were first recommending surgery and medicines. They were not recommending physiotherapy at all. Nowadays, things have changed, scenario has changed. Doctors started trying physiotherapy before surgery.
And patients mentally focus of
Surgery.
They are considering a conservative treatment before the surgery.
Yes.
If it's not working, then only they are going for the surgery.
And also, for example, the most of the people will be depending on the sports games and everything. Even see, nowadays many are doing like football, cricket, and everything. So to spend their leisure time. So it's like, so the most common injury is ACL injury. So ACL is a ligament present in the knee, which provides support. So if it's torn, which will result in severe pain and inflammation on the knee. Okay. So the main problem is that nowadays the ACL injury is very common. And previously, if an ACL injury comes, then what happens is that they immediately go for a surgery without taking a conservative treatment or anything without going to a physiotherapist. So if it's a grade 1 or grade 2 tear, then definitely we can correct it. Okay, if we strengthen the muscles and if we'll see if there is any muscle wasting present, and we'll address that, and after that we'll correct it. So nowadays people are doing that. Previously they are straight away going to surgery, but people nowadays are coming for physiotherapy. I think that's also a quite an improvement in our field. So
We
people
are-
are trusting us.
And moreover, we are getting so many patients who had ACL injury and they got rehabilitated.
Yes.
Nowadays, rehabilitation is an important part.
Yes.
Yeah. Now you spoke about ACL, right? A lot of the viewers, listeners might not know what ACL is all about. To be very specific, and I know this is one of the major injury that happens in the field of sports. So I want you to explain what exactly is ACL and what are the injuries related to it and how you can rectify that.
So this is thigh bone and this is a lower bone. Okay, we have a ligament like this that is known as ACL. So the main function of ACL is to prevent the anterior movement, anterior translation of the tibia or the lower bone over this. Okay, apart from that, we have a posterior collateral ligament, medial and lateral collateral ligament. So ACL is the most important ligament because it helps in like anterior translation, preventing that movement, and the stability. It helps in stability as well. So what happens is during the contact sports, there are chances of ACL tear. And if you don't do any exercises or if you don't treat it well, the extent of the injury will increase. So we have to strengthen the muscles around, mainly the quads, hams, and the calf. Strengthen the muscles around the knee joint, and you will be safe enough.
First of all, in every match, we should go for stretchings before the match and go for all warm-up exercises. Then enter the match. At least we should go for 30 minutes of stretching and warm-up exercises. Then also after the match, we should go for cool-down exercises. If you are going with the pattern, the injury will be less.
So nowadays, many are skipping the warm up and cool down. That's one of the major reason for this kind of injuries. Warm up and cool down is a must. So we shouldn't skip it at any cost. And also we need to check. See, the muscles are like, it's like a rubber band. It has the property to, it has the elastic property. So if it doesn't stretch well, it can result in stiffness. So in most of the ACL injuries, the hamstring, the back muscles, the hamstring, the calf, and the quadriceps muscles will be tight. So which results in injury on that particular area. Okay, on the knee joint. So if we correct all those things at the earliest, the less chances of eliciting ACL tear and all of that. So practice warm up and cool down.
So when we have an ACL injury, we do scanning and all, and get to know if it is a grade 1, grade 2. So how quickly a player can come back to the start playing back?
We say of 6 months. 6 months is the time that we give, provided they do exercises on regular basis. If they take rest and straight away they can't go field after 6 months, they have to do 6 months of exercises, then strengthen once, and we need to check the strength before getting into the field. So we have to go to the physiotherapy department or to a gym and strengthen the muscles around the knee joint. Not only the knee joint, the hip, as well as the whole body should be, because he is participating in an event, right? So you need to strengthen the whole joint, the whole body, and you have to roughly we say 6 months. 6 months is especially for the contact sports. Suppose a game like badminton and all, it's not a problem. But contact sports like football, definitely we need 6 months of time.
How a person can understand he or she gained back the strength what was there before the injury? Is there any kind of test for strength checking?
We have a system called manual muscle testing, MMT. So we have a grading system from 0 to 5. 5 is the maximum power, maximum with the full range of motion with maximum power, maximum resistance. 0 is like there is no power. So we need to check whether the patient is having grade 5. When the patient is having grade 5, then he is fit enough for the event.
One more generalized question regarding physiotherapy before we go to Wohl's Physio, because I wanted to talk more about Wohl's Physio, what is Wohl's Physio and all that stuff. I don't know if you have noticed or not. Right now in social media, there are physiotherapists who are coming up sharing reels showing that you can heal your injuries, ACL injuries within 3 weeks, that to a grade 3 level of injury of ACL. I don't know if it is recommendable to do an exercise seeing a person online, or should we directly visit a physiotherapist by person and then treat our injuries rather than seeing it and online. So what's your point on that?
All we need to check is there any scientific backup for all those things? So if there is any, I mean, I don't think if it's a grade 3 ACL tear, we can bring immediate results in 3 weeks. See, we don't have any miracle.
Basically, no, they are putting the thumbnail to get more audience.
Yes, exactly. That's what. If we go deep into it, the relevancy or the in the genuinity would be very less, not assured. So that's what. So I think we
First of all,
shouldn't be relying on all of this.
First of all, we should consult the direct consultation done, and we should get the exercises what we need, not the generalizations.
See, we cannot treat, with hand or anything. It's all about exercises. It's all about strengthening.
Yeah.
Only if you strengthen those muscles, you can, get rid of the pain or any such injuries.
Yeah, rehabilitating is not only exercises. We need to check the girth, girth, right? So we need to get the girth measurement, and we need to compare with the normal side. We need to palpate the muscle. We need to find the texture of the skin. We need to find out whether the power. So if it is online, we can't check the power. So for all these things, again, we need to check the range of motion. Range is like available range. So suppose this is elbow, and suppose if I have 145 degree here, and I should have 145 degree here as well. So I need to check with the normal side. So if it is online, we can't check it. I don't think in physical, it's not, there is no contact, right? So better to be in a clinic.
Yes, and also if one leg is affected, then other leg will also be affected, because you'll be like, if one is done right, because of the affected leg, we'll be depending more of weight on the other side, right? So which can result in strain on the other leg as well. In order to address that, you need a physiotherapist who will suggest you what to be done after this and all of that.
On top of that, we need to check the gait analysis. So gait is nothing but the walking pattern. Suppose you are correcting your muscle power, the range, the girth, everything is done. And if it is walking pattern and running pattern is not correct, it will affect the performance. So that is also part of our treatment.
Especially those ones who are having this flat feet, like loss of arch. So those ones, the walking pattern would be different. The weight distribution would be different. So in order to address that or educate them, we need direct consultations. So I don't recommend all such things, but still it's according to a person's will. If they want such kind of, if they believe all those things, I think they can try it and just wait for what happens next.
Thank you for that explanation. It means a lot to the viewers and listeners who are listening this podcast. Now the main question, what is Whole Physio? And you all are working for the same organization, Whole Physio. And one question, what is the problem that Whole Physio is solving right now?
Physio, as the name indicates, it's about wellness. So we are mainly focusing on the wellness of the patient. So our main chief physio is Mr. Ashley Tony, who used to be the physio of the Kerala cricket team, and now he's absent here, or else, yeah. So he's there. He used to be he's my mentor as well. So see, the main protocol of both physio is that we will be focusing mainly on the wellness of the patient. We make sure if the patient who complains of the pain is, we are focusing mainly on the betterment of that patient. So once if the patient is complaining of the pain, we will make sure if he's, he'll move from he
Completely.
completely recover from his pain. So I think Hyshem will explain more about Wohlphysio'S.
Yeah. Actually, across state, we are mainly focusing on the wellness of the patients. Most of the patients are fully recovered from our clinic after the treatment sessions. Even most of them are coming from Trivandrum to Kochi and staying here for the treatment, and Kasaragod and staying here for the treatments. And most of them are recovered.
Okay, the main difference from Wohlphysio when compared to the other clinics is like it was a normal assessment. Apart from that, we focus on biomechanics and posture and gait. Biomechanics is the way they are using their joint, the correct way of movement, correct pattern of movement with the exact muscle, and the gait analysis, as I've explained, that's a walking pattern. And regarding the posture, the sitting posture, standing posture, the body, any alignment, any curve is there, that if it is like alignment is not correct, we'll correct it. So it's not only the so the 99% patient will be having pain. If come with pain, we'll get it done, but we focus on mainly gait, posture, and biomechanics. So that is different from the rest of the clinic. That what I feel.
And also we are having trained physiotherapists and have done additional courses as well, like dry needling, dry cupping, and kind of salty taping or some other mobilization techniques as well. So I think with all of this, we can bring amazing results to the patients as well. So already we have done it before and we are still doing it again.
And we also have IP clinic, inpatient clinic.
Yeah.
So patients have facility to admit the clinic in the clinic and go for the treatment.
And also we are having home care facilities as well. So if a patient is bedridden and they are not willing, some old age patients as well, right? So for them, we are giving treatment at their home as well.
And on top of that, if the patient is done with the treatment, we'll have a follow-up session. We'll call them on a weekly basis or after 1 month or 2 months, like just to check whether how is the pain, and if they have to come for exercise. It's not like after 10 days of treatment it's done. No, you have to come after like 1 month and like every 6 months, or like if they are available back in India, they need to come on regular basis to check whether their posture or pain and gait, everything is like done well.
And also we are focusing mainly to bring back the functional capacity of a patient. So it's like once the pain is done, once the pain is gone, we'll be focusing on the exercises part and we'll make sure the exercises are repeated here in our clinic. We have an exercise room for that. So we'll be making the patient do the exercises, and after that for 3 or 4 days, and after that we'll be doing a follow-up like every week. So we are just making sure that he is, and the treatment which we have given is effective for he or she. Okay. So, which is also an importance. It's not like we are giving the treatment and we are just asking the patient to leave. It's like we are following every patient.
It's a question for every one of you. I just wanted to know one thing from you, that one challenge that you faced in your entire career and you have solved that. I know there might be lots of challenges that you have faced as per your experience, but one challenge that is non-forgettable and you have solved it in a great way.
Down the memory lane, I had a patient who was getting ready for an event. So it was a short notice. The event was like short notice, and patient had to compete in 1 month time. So he had an ACL injury that was just grade 1, but the muscle power was very less. So I asked the patient to come on regular basis. He was fully dedicated to his passion. Passion was like football, and he left his job and he fully dedicated for football. And he came on regular basis and he got rehabilitated. His part was normal. The gait analysis was done. The posture analysis was done, and he was fit enough for the event, and he won the game.
As a sports physio, in my initial stage means just only 1 year before, I have an incident that one player hit a ball on his chest and he fell down. And he was like going for the fixed like condition, like Caesar. He was shivering, and his eyes were gone down, and he was pumping the blood from his mouth. It's not my initial stage actually, and I have given some CPR to him. It was not working for him, and the hospital was not nearer to the college. It was a college game, a football match, and so we should do an initial first aid to the person. He was only just 18 years old at the time, and I had given a CPR, but it was not working for him. He can't breathe. He had going for the Caesar, and I had just opened his mouth. He was spitting the blood, but his mouth was clenched, like he can't open his mouth. So I just pulled up the mouth, opened up the mouth, and I had noticed that his tongue were rolled down underneath, so he can't breathe to the mouth. So I have done was I had just pulled its tongue outside his mouth, and at the time only he had got breathing, and just he got safely for God's grace.
Great one, Hisham. It's so emotional to hear itself there because how was that
Yeah.
situation? Yeah, Rosmin, anything from
Yeah, since 3 years I've been here, I've seen numerous cases which brought results for God's grace. But still, one that comes to my mind when you ask this question is that my one patient came here with juvenile kyphosis. It's otherwise called Sherman's disease, which was like, the recovery would be, very less. So, or else it would take much longer time. So he had given me a time duration of 2 to 3 months. So he was ready to take the treatment, and once it was a challenge for me as well. So once I have started the treatment, I was like, fully focusing onto it. I was like preparing for it as well. I was just when I go to home, I used to go to the articles, for the updated articles and everything. And after that, after 1 month itself, I could see, tremendous result on a patient, which I think is also a, career break for me as well. So I feel so fortunate for that.
One question to Suneel Sir. I know you have 22 years of experience in the field of physiotherapy, and I know I am mentioning it again and again. I want the viewers, listener to know that you have an experience in physiotherapy, and that too of 22 years. That's the reason I am mentioning it again and again. So could you let know one advice to that aspiring physiotherapist who is just starting their career? What would be that one advice that you would give to him or her?
Only on medicine and surgery, so if he won't be interested in doing a physiotherapy course. The person is focusing on their well-being, their muscle, their flexibility, their rehabilitation, their happiness, their posture, their gait, and like overall, we say holistic approach. If a person is focusing on a holistic approach, then physiotherapy would be challenging but interesting. It's been challenging but interesting. So I should say, like, if you are really interested and if you have a passion towards it, you have to select. It's not like someone should force person to join physiotherapy. If you have a passion towards that, because we need to treat pediatric as well as geriatric cases, not only the pain normal youngsters. We need to take care of the pediatric cases as well as old age cases. So patient, we have to think about the different areas where we need to work. Suppose we are working in an old age home, we need to take care of only geriatric cases, old age cases. So, dealing with them, it's a bit difficult. Even we are posted in psychiatric ward as well. So, we need to think about the future, like these are the things, do's and don'ts, these are merits, pros and cons. Then you have to take this profession.
Rosmin, you have 3 years of experience in the field of physiotherapy and you are a senior physiotherapist at Wohlphysio'S. I want you to give an advice to Hyshem and how he can grow in his career from the current role to a senior physiotherapist. What would be that one advice to Hyshem and all that people who are looking from a jump from their initial stage to the next stage?
As I can see, Hyshem has already completed his 1 year at Wohlphysio. I can see tremendous result in his, while dealing with patients and everything. So what I have to say is that be passionate and also have patience. Have patience with patience. You understood, right? Yeah, it's like if we are just like pushing the patient or we are just fastening the process, it won't bring results. So we need also give time for it. We need patience and also be passionate about this. The physiotherapy, it's all about compassion. So if you don't have that will to treat the patients, then I don't think you will be focusing or you will be referring articles or you'll be like bringing new techniques to for the betterment of the patient. Only if you're passionate enough, then you can bring the results.
Hyshem, a question to you. What is your career goal and where you look 5 years down from now? What would be that?
Be a good physiotherapist, right? To heal the patients and a good physio.
I don't know this one would be a challenging question or not, but I would like to ask each one of you what a physiotherapist should do. Like, should they start their own setup doing freelancing, or should they join an organization, work for a few months, and then plan to do a new stuff like creating their own business? I want a career path for a physiotherapist. So, how it would be from your perspective?
Initially, if I can say, as a fresher, we won't get placed in a hospital. So you have to work in small clinic. Okay. Once you get experience, you have to focus on not only ortho. Majority of the physio cases are orthopedic cases. So you should think. You should work in an orthopedic, neuro, cardio, pulmonary, sports, geriatric, and gynecology. So we have different areas to be focused, and we can't work in all these fields in short time. But you should not focus on ortho cases. We need to learn about all the other cases. So first few years, I can say like first 3 years, you have to work like 1 year in ortho, then the next year in neuro, then in cardio or in a hospital. Third year should be in a hospital, wherein you will get a chance to work in different departments like ICU, pediatric case, geriatric, stroke, neuro, all those cases. So you'll be fit enough to work in any part of the world. The first 3 years should be like this.
One question, I don't know if this is a funny question or not. You all might have heard it, right? A physiotherapy session cost too high and too expensive. Like one session cost almost like 1,000, 2,000, 3,000. So what's your point on that?
See, I always believe if we are giving that quality treatment, then we would charge, right? So if you're really good at something, don't do it for free, right? So it's like, so yeah, we are providing quality treatment. That's why I think it's okay to charge.
One last question to every one of you. I would like to know, and the viewers, listeners would like to know where they can come and meet you. Where is Wohl's Physio, and what is the location that they can come down and meet you personally, and if they have any kind of injuries and get an treatment from your side.
Okay, so overall we are having 3 branches here at Kochi right now, and one in Panambali Nagar at 14 Cross Road, and another one in Palarivattam at South Chandra Road, and another one at Kakarad, Trikakara. So these are the 3 branches. You can go for a consultation if you want, and also we are having IP facility at Kakarad. And also we are having a page and an Instagram. So if you go through our page, Wohl's Physio, you can see all the details, and you will get. And if you go to the website, you can get the phone number as well.
Thank you. It was a great podcast. Thanks for your valuable time. It's almost like 1 hour that we are discussing about physiotherapy. Thanks for that. Really means a lot. And hope so I meet you all in person in Wohl's Physio. and really thank you for your time. I know patients might be waiting for you. It's a busy day, it's a Friday. Thanks for your time. Once again, a big thank to each one of you, and meet you soon, and hope so some of the viewers, some of the listeners who are listening this podcast gain some great information about physiotherapy, and if they have any kind of injuries or pains, they do come down to Wohl's Physio and have that treatment done from the best physiotherapist in the town. Thank you, and meet you soon. Bye bye.